Do you have a pain in your butt and you're not sure what's causing it? Maybe you've searched on Dr. Google and you can't tell if it's Piriformis syndrome or sciatica, or you don't know the difference between the two, or you've talked to your friends and they say it's this and they say it's that, and you're just confused about what the next best steps are for you. Well, then this video is for you, because today we are talking about what the difference is between Piriformis syndrome and sciatica and what you can do about it. Let's talk about Piriformis syndrome first. So if you're suffering with Piriformis syndrome, you probably feel like you have a knot in your butt. And you may even feel like when you're sitting on it, like you can feel like you can roll over it, or maybe you want to put a lacrosse ball in your butt and try to rub it out. Then you're most likely suffering with Piriformis syndrome. If you feel like you want to stick a lacrosse ball in your butt and try to massage it out, yep, that knot, that's where the muscle is. That's where the piriformis is. It goes from the tailbone, also known as the sacrum, to the hip. And so it's kind of deep in there because it's underneath the glutes. If you feel like there's something like stuck in there, that's Piriformis syndrome. You also will notice that you have hip stiffness because the piriformis muscle does attach into the hip. So most people who are suffering with it feel like their hips are not moving correctly. Now with Piriformis syndrome, you will often have decreased symptoms when you're standing or walking. And this confuses a lot of people because they're like, why does it feel better? It feels better because you're moving the muscle. You're causing the muscle to contract and relax, which is bringing blood flow and helping to heal it. So it feels much better when you're standing or walking, and that's a very clear indicator of Piriformis syndrome. Now, how do you know if you have sciatica? Well, sciatica can often send symptoms like numbness and tingling into the leg. So it may start in the butt, it may start in the low back, but often it will go down the back of the thigh and the side of the leg. So if you have any numbness or tingling that's traveling down your leg, then it's most likely a sciatic nerve issue. You also will a lot of times have cramping in the hamstrings. So people will report that they feel like their hamstrings are really tight. So those are the muscles in the back of your leg. And they feel like they can't like stretch them out. And even when they try to stretch them out, like it never releases. That muscle stays really tight. It may even be cramping at night while you're sleeping. That indicates that the sciatic nerve, which innervates the hamstrings, is irritated and causing increased cramping to the hamstrings. The other thing is with sciatica, you often will have increased symptoms with standing or walking. The reason why is either one, you have a situation going on in your low back that's affecting the sciatic nerve, which is where it starts, and it's not moving correctly when you're standing or walking, or two, you have a really tight piriformis and it's actually causing a compression to the sciatic nerve, which is what's sending the symptoms down the leg. So what causes Piriformis syndrome or sciatica? Well, it can often be caused by a muscle imbalance, which causes your hips to be out of whack or out of alignment. So if you've ever been told that one leg is longer than the other, or you feel like your hips don't sit in the same position, some people will notice whenever I try on pants, it doesn't feel like the waistband hits equally on both hips, then you probably have a pelvic malalignment, which is also probably causing a muscle imbalance. The pelvic bone can get stuck in a certain position, or sometimes it can even move too much. Often in my practice, I see people who have gotten stuck in the wrong position, and they'll notice it because it causes everything on kind of one side to tilt a little bit to that side because the body's trying to equalize everything. It's important to remember that your body wants to keep your eyes at the horizon, and it will do all kinds of crazy things to try to keep you there. So if you have a pelvic obliquity is what we call it, that means your hip bones are out of place. It's going to cause everything to kind of rotate up through your spine as your body compensates for that. And often we see this problem, especially with sciatica, with either a lower back issue, including a disc issue or a stenosis. So disc issues tend to be more acute. They flare up, they get irritated, things get really hot and bothered, and things start tingling. A stenosis you see more come on slowly over time. You start to notice that you're more stiff, it's harder to bend, it's harder to put your socks on in the morning, and you start to slowly lose more flexibility. over time. So a stenosis is more an over time, whereas a disc issue is more of an acute situation. The thing is, no matter if you have sciatica or piriformis syndrome, it's important to know A, what's going on, so B, you can actually treat the root cause. If you're treating the wrong one, you're not going to get the long-term results you're looking for. And you also need to treat what caused all of it to start with in the beginning. If you have a pelvic obliquity, whether it's causing piriformis syndrome or sciatica, you have to deal with that because neither one of them is going to get solved if you don't deal with that in the long term. Now on to you. What questions do you have regarding piriformis syndrome versus sciatica? Drop them in the comments below and we will make a video just for you. Have a great day, everyone.